Are we live? I believe we are live. I believe we are live. What's going on, everybody? We got a couple people in here. Let's see. Let me see here. I think Roel's in here. Roel, what's up, man? Hope everything in Texas is wonderful and beautiful. We on Instagram. We are. What's up, Francis York, Amy Burke, Miss Cub? What's up, Jerry Parrish? How are you guys? Great to see you guys over there on Instagram. Thank y'all for hanging out. Uh, Amy, so good to see you. So good to see you. Thank you for being here. Ray, what's going on, man? Hope you're doing well. We need to catch up, man. We need to catch up. I'm going to hopefully get to Christ Fellowship here shortly. Uh, let's see. Laura, what's up? Florida, where in Florida are you at, Laura? Coal miner's daughter. Hello, hello. 5 times 5. Does that mean 5 people are with you? What's going on with the 5 times 5? I love it. Tom, what's up, brother? Tom, did you get a workout today? I got a little workout before this. I'm proud of myself. I probably wasn't using the same weights you were using, but I still got it in. Carter, what's going on? Happy Tuesday to you. One thing I like to do with Carter's, there was one Tuesday, I forget when it was, when she texted me. I think it was a Monday, and she said Happy Tuesday, and so now I like to switch them up. It's Happy Monday, Carter. Tabitha, what's up? Great to see you. Thanks for being in here. Jack, what's going on? Man, we're getting some people in here. Thank you guys so much. Y'all mean the world to me. Thank y'all for being with us. We're gonna have such a good night tonight. I think last week was one of our best shows, and Dad and I've been talking just how much we enjoyed last week, and I just feel a lot of good energy going into tonight's show. So thank you guys. Margot, what's going on? I'm in the North Knoxville office. Margot's our PA here, and I'm overlooking the Fountain City Park right now. Huge shout out to North Knoxville and Fountain City. Go Central. Shoot, I really need to know the mascot of Central High School. Grandma Mary, what's up? I appreciate you more. Had such a good time with you Saturday. Stan, what's up? Great to see you guys. If you guys got questions for Dr. Rogers, go ahead and put it in the comments. We're going to have a really fun show tonight. Michelle, hello. It's so good to see you as always. Oak Ridge is in the building. Shout out to Oak Ridge Wildcats. I know that because I went to Oak Ridge High School. Bobcats. Thank you, Carter. Thank you, Dustin. I love that. Bobcats. Go Bobcats. They're literally about 100 yards from where I'm sitting right now. As you guys know, we send out Performance Weekly every Tuesday. Goes out around 3 p.m. And this episode was super fun on the Common Sense MD. As you can see, that's Hannah Blackwell and Catherine Markham. They are pharmacists over in Markham's Pharmacy. Markham's Pharmacy is super near and dear to my family. Markham's Pharmacy has been around for a long time over in Kingsport, and kind of little cool story here. My granddad used to write scripts into Markham's Pharmacy, so we go way back. Huge shout out to Markham's Pharmacy and Catherine and Hannah. This episode was all about compounding and local independent pharmacies. Kind of the catch line here is get to know who your local pharmacists are. Get to know your local compounders. It's important in today's healthcare environment. Really important. So whether in East Tennessee, Knoxville, Kingsport, Johnson City, Texas, get to know your local compounding pharmacist. I love that, Courtney. Go Cougars. There we go. I love that. We got any Sullivan Central people in here? My mom taught at Sullivan North when Sullivan North was a thing. Is Doc almost ready to roll? All right, let me get this up real quick. The star of the show, Robin Riddle, on Explain This this week. Talked about recurrent pregnancy loss. One, I know all of us have people close to us who have had, multiple miscarriages in a row. Robin kind of details what recurrent pregnancy loss means, what it is, and some things that you can do to change the trajectory. Really, really amazing content from Robin here. As you know, Robin specializes in functional fertility. So please, if it doesn't relate to you, maybe it relates to somebody that you know. So if you haven't shared that podcast, please do. That means a lot to me and Robin. Katie, what's up? Great to see you. E-Town is in the building. E-Town. That's right. It is Knox Central. Steve, my brother's in here. Steve, I'm thinking about you. Thank you for the text. I'm thinking about you. You let me know what I need to do. Okay. I love you, man. All right. Let's see. Let's get Doc in the building. Is Doc ready? I know you don't like when I do the small talk. So, but I'm just,
mind it a bit.
I have such a good time with the people in here. We got 28 people here.
Yes.
They mean the world to me, and we have such a good time at this intro. Thank you guys for. You're an Indian. You're a Go Indians. We're doing a little high school football tonight. I see Green Waves are in here with Coal Miner's Daughter. E-Town's in the building with Cyclones. Got Sullivan Central. I'm next to Knox Central.
Well, the Dobbins Bennett Indians, I went to the game Friday night, and we beat Knox Farragut. So,
yep,
that's a good win for us.
That's a very good
Close
win.
Game. Close game.
Very good. I see Kathy's in here. Edna, what's up? Jana, what's up? Thank you so much. Doc, how's your day, man? I love the hat, man. Those hats are so
cool. I wore it because you gave it to me last week. Thank you.
I absolutely love those hats. Ivy, happy Taco Tuesday. Tacos are coming my way here in about an hour and a half.
Oh, good.
I love it. Montana, so good to see you. Thank you for all that you did over in the North Knoxville office today. It was so good to see you in here. Okay, let's rock and roll, man. You ready?
Ready.
Just got word that Lighthouse Christian is in the building as well. Huge shout out to the Lighthouse Christian alums. If we have any in there, I love that. You ready to roll?
Yeah.
All right, guys, y'all know the drill. If you have a question for Dr. Rogers, go ahead and put in the comments, and Instagram, I'm looking at you as well. If y'all have a question, I see Ray has a great question around methylene blue. Kendra does as well. Thank you so much. All right, let's rock on. In general, and I know that every case is different, can someone diagnosed with lupus still do bioidentical hormone replacement?
Of course, yes. There's no contraindication of that.
No problem there. Easy one to start off with. Thank you for that question that came in through email. This one we talked a little bit of a piggyback off of last week's discussion with curcumin and black pepper. All right, I'm going to read this out for everybody. After last week's discussion on the fact that curcumin needs black pepper for absorption, I looked at my Life Extension Curcumin Elite, and black pepper is not listed. I know Life Extension is a quality source. So what are your thoughts on this? Do you think there is something else in their proprietary blend that works like the black pepper? Super good question.
I used to take this same one, and it used to have this thing called bioperine in it, which is really black pepper extract. So it was in there, but the last one I saw didn't have it in there. It had something like, I think they called it ginger turmerones. I don't know. They claimed it helps the absorption like black pepper does, but kind of the standard is black pepper. And if they took that out, which the last bottle I looked at, they had taken it out for some reason and substituted some other proprietary blend of something that I never heard about. But I also looked on there and I saw that they had some other stuff in it that they tend to put some fillers in their bottoms that they didn't used to put in. I'm a big Life Extension believer, used them for many years, but they're starting to put some fillers in them. Like I think they put lecithin in there. in the curcumin. And what else was in there? Just look at the ingredient. Always look at the fillers. That's one main reason, besides combining a lot of these vitamins together, so that you don't have to buy so many. That I picked out my own Freedom to Formulate company out of Oregon, who puts together what I want with no fillers in them, and in the doses that I like, and I can combine them. Like my new pain formula, which is working very good for me, by the way. I've noticed a lot of difference in my pain formula. I've been working on that for 2 years, and finally I have it. And you don't take one pill and all your pain goes away. I think it was about 5 to 7 days before I really noticed that for some reason my back wasn't hurting. As you know, I have a really bad back, a lot of arthritis, degenerative changes, and it's really helping me. So I'm really pumped up about that one, and more than any I've ever put together is this pain formula. So, because everybody that comes to me, either they hurt or they're tired, because I see a ton of baby boomers, and you can get on hormones, which helps tremendously, I think, even for pain, but you still need some good natural anti-inflammatory ingredients in there. So if you look at what's in mine and the different things that are in it, I think you're going to go for that over some of the other things, like Relief Factor that you see advertised all the time on one of the channels. That doesn't have a lot in it, to be honest with you, but some people really like it. And that's why I decided to create my own that I thought would work a lot better. But anyway, yeah, but you're right. You're right to start looking at those ingredients.
I love that question, and thank you for mentioning that with the pain formula. I see Ivy's been taking it as well. Thank you, Ivy. I'm super interested to kind of hear some
give us some follow up. I really want to hear some follow up.
Feedback we're getting in the offices, and we'll be sure to let everybody on this show know kind of what's happening with that. We're super pumped about it. I see Jamie's in here. Jamie, it's so good to see you. I think you saw Jamie at the game on Friday, but
I did. We had a good talk.
But I gotta say, Jamie had the comment of the day yesterday. It just made me so happy. So thank you. You know what I'm talking about, Jamie. Thank you so much for that amazing comment. It was wonderful. I need to start doing like a comment of the day or something.
You do. You really do. I've got some good comments that I hear, that I pick up on, that a lot of times I'll write them down and try to remember them,
because they help other people too.
Yeah.
So it's super fun. So thank you, Jamie, for that. Let's keep moving here, because I'm already seeing some questions coming in. Thank you guys on Instagram. I see you. We're going to get to those questions in just a second. These came in throughout the week over email. And this is around creatine. Let's see. There we go. I want to order some creatine capsules to use while traveling, easier than taking the powder. Do you have a brand that you would recommend for capsules? Life Extension goes on to say, the guys at my gym all try to tell me that creatine HCl is the better form to take, but I know you say monohydrate is. Please talk about this a little bit. What's your thoughts? I guess that's two questions.
The most study accepted form is the creatine monohydrate. They have a ton of studies that show this stuff works. There's no doubt. Now, I know there's a bunch of other forms of creatine you can get, including the hydrochloride. And from what I've read, it may be a little bit better absorbed. But the studies just haven't been there. And so I'm not against that one at all. I mean, they say, well, you can take a less dose of it because it's absorbed better. Like take 2 milligrams or 2 grams instead of 5 grams. But the standard dose is usually 5 grams. And I really haven't found that you need to load with it either. Just start taking it. The hydrochloride may work a little quicker to get on board, but I mean, there's really not a big rush for that. And the fact that the monohydrate's been around forever, That's just something. If you look it up and look at all the studies, they're all on the monohydrate. It could prove down the road that some people prefer the hydrochloride just because of quicker absorption. I mean, some people take creatine, pre-workout for energy because it does help release ATP. Some people prefer it post-workout. The other thing I like with creatine is the HMB, the hydroxymethylbutyrate, which I put in my own blend of it because it kind of works synergistically with the creatine to build muscle. It kind of turns on that mTOR pathway, which is growth. It's anabolic. You need your periods of growth. You need your periods of rest. For example, rapamycin is an mTOR inhibitor that you need as you get older if you want to age well. Or you don't need it, but you could. It's optimal to do it. I've been doing rapamycin for quite some time, which is an interesting drug. I think I did a podcast on it maybe a couple of years ago. But
Yep.
I got turned on to it by Dr. Attia, and Sinclair's been, promoting it for quite some time. And so as far as the capsule, I like the powder better. The capsule, maybe you can get a creatine hydrochloride in a capsule. I don't know. I'm okay with the Life Extension brand, but just make sure you look at the ingredients on it. Otherwise, I don't really have a particular favorite for the capsule. Most people recommend that you take the powder for absorption, but they may have come up with a creatine hydrochloride capsule. I don't know. So, but if you do find it, just see what kind of results you have. I'm not against you taking it, but look at the extra ingredients that some of the brands are starting to put in them.
So am I hearing you right that in a capsule form that you only can get the HCl version?
No, I'm saying that's what maybe
Okay.
you can. I'm not sure.
Okay.
But I agree, taking a capsule is a lot easier than taking a powder with you on a trip. Kind of like when I do methylene blue, I take the capsules on the trip. Otherwise, I use the drops.
Yep. I'm the same way. Okay, I think we answered that question with the capsules versus the powder, as well as the HCl versus the monohydrate. It seems this listener is wanting to, when somebody asks, it's more than just my doctor says monohydrate. Seems that there's just more studies around monohydrates. Am I hearing that right?
More studies. The hydrochloride is a little newer. And some people claim, especially in gyms, well, it works faster, which it may. But I found that really, if you're consistent with taking it, I don't think it makes a difference. And certainly the monohydrate has vastly more studies on it. And it's just a great thing to be taking, especially as you age. But also for people to work out a lot.
I loved last week. I think your quote was, the best time to take creatine is anytime or something.
Yeah, why don't you take it? Yeah.
Just take it.
Just take it. But some people do take it pre-workout and they like it better. Some people take methylene blue pre-workout.
All right, let's keep going here. I want to get to the live questions here in a couple of minutes. I see you over there on Instagram. We will be there in just a second. Question here is, would there be any likely issues with having an 86-year-old parent who takes no medications to begin taking creatine? Sorry, I misspelled that. Would it still be helpful for someone at that age? Another creatine question.
Yes, especially helpful for somebody that age because they're losing muscle and it builds muscle and it also hydrates muscle. So definitely, should take it. It's not going to harm the kidneys. It's safe. Again, this is my opinion.
Yeah.
On this platform, we can't be giving out medical advice. So talk it over with your doctor. Come in to see me if you want my, definitely go ahead on it. But yes, I like it for older people.
Yes,
for sure.
I remember when Grandma, your mom, was getting older, and I remember she would take those like Boost protein shakes.
Mhm.
Would you have, this was a while ago, would you have put her on creatine?
Definitely. Oh,
Yeah,
definitely.
yeah,
Yeah. Yeah. And the reason she was taking those was to get more protein in. Most people just don't get enough protein.
yeah.
I love the perfect aminos as well. So more protein for most adults, they don't get enough.
All right, let's keep moving here. We're going to get to the live comments here in just a second. So if you have a question for Dr. Rogers, go ahead and put it in the comments. Since radiation from imaging is cumulative, and those of us who are seniors have probably gotten a lot over 60 plus years before we had digital imaging, mammograms, CT, surgery, dental, chest rays, etc. Should we limit routine optional x-rays like dental and mammograms and opt instead for ultrasound, MRI, or thermal imaging to prevent additional radiation? That's a really
Yeah,
interesting
that's
question.
a good question. Yeah, probably. Again, don't over X-ray, and certainly MRI has no um, radiation to it. Ultrasound doesn't. Thermal imaging, like thermograms, which don't replace mammograms, or they're uh, additive, is how I say it. But yeah, I mean, I don't like getting dental X-rays every time.
Yeah.
Every 2 years, I'll say, okay, you can take them. I don't get them every time.
Mm.
And fortunately, the mammograms now are way lower dose than they used to be. I mean, just riding in a plane, you're getting a lot more you're getting a lot more radiation than you are getting most X-rays. So
It's
I don't
interesting.
freak out about it, but yeah, certainly don't over X-ray things.
Mm.
Um,
It's a really good question, and I know that's helping more people than just that listener. I assure you. So thank you for sending that in. That's going to do it for the live for the questions that came in throughout the week.
Ben, did we have a couple questions from last
Ooh,
week that we didn't
we
mention? Because
sure.
you told me that, and I looked a couple of them up. What were those?
Yeah, I'm looking at my notes from last week. Okay, and you guys will recognize these if you were with us last week. RBC magnesium. So magnesium RBC ranges. The question was, what range do you like to see those in? Remember to get a level on your magnesium levels, we check an RBC. So you want to riff on that real quick?
We don't always check an RBC, but it is the most accurate because it's more representative of what's actually in your blood. Yeah, I think the ranges I read are anywhere from, I think, 4.8 to 6.2 on a Quest lab. That's the lab we use. But you really want to aim more towards 6 milligram per deciliter. Aim for a 6. So anything over 4.2 to 6, 4.8 to 6.2, I think, is normal, but you want it around 6. You want optimal. Remember that.
All right. And then the next one I see Linda in here on YouTube put up around Lepticel, which was also in my notes.
Yeah, I looked that up, and that is a weight loss supplement. You have to be careful with this one because I did look that up, and it's all over the place. I mean, apparently to get the real brand name Lepticel, which is a supplement, you need to go to their site. You can't, if you go on Amazon or eBay, you're not going to get the same thing. So it was all over the place as to the ingredients, but a lot of it's just vitamins, and they claim that this magical series of supplements will help prevent leptin resistance. Leptin's that gut hormone that tells you you're full, and a lot of people theorize that that kind of like insulin resistance, that after so long a period of being obese, it's not as sensitive. So Lepticel, and I looked at the ingredients, they're all over the place, from African mango to, gosh, what else was in there, to black pepper, to ginger, all the B vitamins, vitamin A. But there's a bunch of different formulas that I came across. And it sounds like some of them, like green tea extract, I think was in one of them. Like I say, African mango, black pepper, and just a host of vitamins. But it looks like a pretty good combination, I certainly am not against it. I don't think it's going to hurt you. So, you can certainly try it. And the one thing too, it's very expensive. It's a very expensive supplement, but I'm certainly not against trying it. It's not going to compete with Ozempic or Mounjaro for sure. And again, I like berberine for those that are insulin resistant. I think insulin plays a bigger part really than maybe leptin does, but they all contribute, for sure. The GLP-1 agonists certainly help, and the GIP, but I'm not against it. So that's what it is.
All right. I hope that helps around Lepticel. And then the last one was Rhinophyma. Am I pronouncing that right? There was a Rhinophyma question.
Yeah, that's just a fancy word for, remember a guy that was an actor named W.C. Fields? I think he was an actor, but had a real bulbous nose that was red. And you've seen people that have these really red, bumpy noses. That's what the term for that is, Rhinophyma. And most people think they also call it whiskey nose. And a lot of people think that that's due to alcoholism, but really it doesn't. It has nothing to do with alcohol. It's really rosacea is what it is. And you can get your standard treatments for rosacea, but sometimes they can get so bad that you even have to do surgery on them. That's what Rhinophyma is, rosacea of the nose.
That's interesting. Well, I hope that helps. Thank you for reminding me about that, because I do have that on my list of things to touch on tonight. Are you ready to roll into live questions?
Mm-hmm.
All right, let's do this. Guys, if you have a question for Dr. Rogers, go ahead and put it in the comments. We're going to get to every single one. I see Luann. I see Ray. Sarah from Charlotte. Thank you for being here. Love that around chitosan. Huge shout out to Shield Nutraceuticals and Pure Chitosan. All right, let's see where we're at. Let's go to Instagram here. Let's go Ray's question on Instagram. I can't put this up on screen, guys, so I'm just gonna read it aloud for you. I bought methylene blue at your office based on doc's recommendation. When I looked it up online, the comments were scary. I haven't taken it yet. Can you shed some light on this? Thank you. Ray, I'm so glad you're asking this, because you're right. Some of the comments can be a little alarming. So, Doc, can you kind of
it's a very safe product, in my opinion. Gosh, we use it all the time for many people. I've probably had 2 people that it really activated them too much. It made them a little nervous, but that's rare as hen's teeth. If you read the literature on it, there's so many different uses for it, but they always kind of warn you about a G6PD deficiency, possibly, the same test we do for high dose IV vitamin C. If you're paranoid, you can get that done. You probably want it done anyway in case you ever have the need for IV high dose vitamin C. A glucose 6-phosphate dehydrogenase deficiency, which is rare. But again, in the doses you're using for this, it wouldn't matter. Kind of like it wouldn't matter for even moderate doses of IV vitamin C. Like in a Myers cocktail, I never even checked for a G6PD deficiency. But that may scare you with serotonin syndrome if you're taking, like an SSRI like Prozac, Zoloft, Paxil, Lexapro, that round, but I haven't found I've never seen a case of that. Anyway, it is a natural MAO inhibitor, but you don't need to worry about cheese or beer. So I find it to be very safe. If you're paranoid about it, start with, 4 drops a day and then go on up. I mean, again, we don't use real high doses of this stuff anyway. They're even giving it IV in drips. The main form of IV is to save your life from carbon monoxide poisoning or cyanide poisoning. Every ER doc knows where it's at, but it's got multiple uses. It's a natural antifungal, antibacterial, anti-parasitic drug. It was the first drug used to treat malaria. So I'm trying to reassure you that I think it's safe. I'm not giving you medical advice, of course, but don't be scared of methylene blue.
Yeah,
The only thing you should be scared of is letting your dogs get into it and get it on your dogs because it stains everything. And take it with vitamin C, it just makes it work better.
Yeah, it's a really great comment, Ray, and I'm so thankful for it because I really want this place to be a place where you can bring your concerns, because a lot of this stuff that that we talk about, if you read the right website, it'll scare
Yeah.
the daylights out of you. We
Scare the
deal with
what
this
out of
with
you? Daylights?
daylights.
Oh, daylights, okay. Yeah, I was like, if you if you read what an aspirin or a Tylenol could do to you, you'd never take one. It'd make you paranoid, but,
Yeah.
you know,
No, it's a great question. Ray, let us know if that helped
thank you.
any, and if we can, if there's any specific concerns that you want us to talk about, we'll talk about those. I got an eye on Instagram. Okay, let's go to over to Facebook. Let's get my brother Steve in here. Steve, unfortunately, I tested positive today. This is in regards to COVID. What is the latest protocol? So, Steve, we hope you feel better. And this is definitely going around. I know you're seeing this, Doc.
Yeah,
What's kind of the latest for Steve?
yeah, Steve, you'll be fine. But yeah, this we're having a summer COVID wave for sure. I've just had one person that lost taste and smell with it. Most other people just feel like they have a cold, a mild cold. Some of them, I've only seen one person where it really affected their lungs much and they got over it very quickly. But yeah, I still use the same protocol. I'm not as aggressive as I used to be in the past, back when the original mutation was there. We poured everything we could into it. But
Can I put
definitely.
can I put this up here for you to see and just see if this is still somewhat? This is a little dated, guys. So let's go over this for Steve and just see kind of where we're at.
Yeah, I mean, I hit it with high dose vitamins. I always use a Z-Pack. Again, I think Z-Packs help for viruses. But that, I mean, that we hit it kind of hard before, but you can certainly follow that same protocol. Zinc's important. Vitamin D and C are very important. But we just haven't seen the complications, knock on wood, that we did before. But just keep us informed. If it starts to affect your lungs, or you can always have an O2 sat monitor around. If your O2 sats get low and you start getting short of breath, you need to let me know immediately. But this just hasn't been the case with this mutation. Every time it mutates, which is daily, monthly, weekly, it becomes less virulent. And usually the people that it really affects badly are those that are severely compromised in other ways. But yeah, just let me know. But get on that protocol. Definitely, I would get on a Z-Pack. Definitely get on a Z-Pack, and that I word that we used that you didn't put up there, I don't think, Ben, that we can't use. I'll call it ice cream, which I think we used to call it. I think that's very helpful. I guarantee I'd be on it. So,
Steve, let us
take
know
your
if that.
digest shield to make sure it doesn't mess your gut up.
Yeah.
Because when you're on a lot of things, you can certainly get some gut microbiome disruption. So, but yeah, let me know, and you'll be fine.
Steve, I hope that helps keep us updated. Let's get to Edna here. I'm having a PRP with Jill in September for my knee. I'm excited and nervous at the same time. I have arthritis and also torn meniscus. Any kind of words of wisdom for Edna here as she's heading into this? Because I get it. There's a video that you recently got PRP. Anything you can do to kind of ease her?
Yeah, here it is. Be excited, not nervous. Be excited. Number one, if you saw the video, Jill does not hurt you, for one thing. For one thing, she's so skilled at injections, it's unbelievable. But she's done both my knees twice. She's also done my shoulder. and my thumb. But anyway, I think it's a great treatment for that kind of problem you're having. Just be pumped up. I mean, the centrifuge we have takes the white blood cells out, so it's not, it's not a real intense inflammatory reaction like the old ways of doing it. So you're in good hands. Let's just put it that way. You'll be pumped, and you'll probably get a good result.
And
Um,
and I don't know if you've watched. I think we have 2 videos of Doc getting a PRP, and I'm pretty sure we videoed the entire thing. So you can definitely tell that it's not painful. It's definitely different than I guess what PRP could have a reputation for in the past as being a little painful. But
yeah,
but definitely
no
check those.
problem. You'll be going out of there thinking, what was I worried about? So.
Yeah. I hope that helps. Edna, let's go to Instagram. I see Kendra has a great question. Where was it? There we go. Kendra is asking on Instagram, does your office and staff accept shadows in the office and train other providers? That's such a great question. What's your thoughts on this, Doc?
Sometimes on a case-by-case basis. Sometimes we do. We're probably going to get into an official training of other doctors on how to do this kind of practice. Again, it's not just something I open up and say, yeah, come on in, because it's time consuming to do the teaching. Especially my office is very small. But on a case-by-case basis, we may do it.
Yeah. It's and I will say, Kendra, it's something that we're thinking hard on, just in terms of how we can do it from a bandwidth standpoint. We know that we're limited in the number of offices we can open, and we believe that there needs to be more places like performance medicine, and so we're thinking a lot about it. And Kendra, I will keep you posted with what we come up with and what we can do.
Thank you.
Thank you for that comment, Kendra. That's awesome. That is awesome. I'm going to put this up just this made me smile when it came across the feed. Donnie, thank you, man. Super sweet comment. Been on 2 visits. Feel night and day different. That's awesome.
Thank you.
All right, let's keep moving. I see Tom is asking about a reverse hyperextension. I love this question. Have you ever tried a reverse hyperextension for your back pain?
I have tried it, and I think it helps. Right now, I'm really working on strengthening the left side of my body up because I have scoliosis and I'll pull to the right. So I found out I'm much stronger on the right side of my entire body than I am my left. It's very asymmetrical. So, yeah, and I also I do a lot of shoulder hangs, with the just dead hangs. And, I have tried reverse hyperextension. You got to be careful you don't overdo it. I have a machine at my house that does that. I also twice a day get on a teeter board where I hang upside down. If you do it consistently and for long enough, it really helps lengthen that spine out and for the spasm. But thank you for being concerned. You probably have experienced some back pain too, and it's so common, and it can be debilitating.
Yep.
I can honestly tell you, I'm almost 70 years old, and that's probably the only thing that really bothers me is my back, my low back. And, I don't try to let it limit me in anything I do, but certainly I'm aware of it. But I'm doing a lot of things to overcome it. That new pain formula is really helping me. I hope it's, not placebo. I don't think it is. I really think it's helping me. To tamping down that inflammation. I have a lot of spasm in my back too. But I usually, I have a couple offices in Knoxville, and usually when I drive to Knoxville, work, drive back, my back is pretty tight and sore. Matter of fact, I usually stop halfway and get out and walk around at a rest stop. But Sunday I went up and back and when I got back, I noticed my back was not hurting me, and that's the only thing I'm doing differently. So I've been on it,
Mm.
2 or 3 weeks now, and I like it. But thank you for that. That's definitely a stretching, strengthening type thing you can do. You just don't need to overdo it. But
I was with you this past weekend, and I saw you do the thing where you go upside down, and I told you I don't like the way it makes my head feel, and you said that's kinda good for you when you have your
you have to get used to it. But you get
yeah,
a big rush in your head. Of course, all the blood goes in there. But it's actually great for cognition. It's great for sleep. I try to do it before I go to bed. I do it in the morning to wake me up.
mm,
And I'm upside down for at least 10 minutes. But when I first started doing it, 30 seconds to a minute was all I could stand. But
yeah,
you really get used to it. You know, for somebody that may have a rare berry aneurysm in their head, it may not be good. But I've talked to some neurosurgeons. They say that is not going to, certainly won't cause it. And it won't bust one either. It's mainly blood pressure related. But anyway, thank you for that comment, Tom.
thank you, Tom,
Thanks
for
for
that.
caring about my back.
Yeah, I love that. I love that. Thank you, Tom, for that. Let's keep going here. I wanna get to, okay, this is Wilma on YouTube. Shoot, I think, Wilma, I'm gonna get to your first one first. Let's get to this one. What do you think about rapamycin for solid tumors? I understand it doesn't work like chemo. What's your thoughts around this?
I've read reports of rapamycin for solid tumors. I mean, they use rapamycin for a lot of things, and I think there's a lot of credence to it. Again, there's different types of tumors that may or may not respond. It definitely doesn't work like chemo, but it has been studied and used for that. But always talk to the oncologist about it.
Yeah.
Anytime I do some of these alternative cancer treatments, I always like to make sure the oncologist knows what we're doing.
Yeah.
For example, IV vitamin C, should you do it before, during, or after chemo? And you can actually do it all 3 phases, but some of them do not like you to do it during chemo. I always respect that. But, with cancer treatments, we're trying to use both the traditional and the alternative, everything you can do. But that's a great comment. They even put rapamycin as a coating to heart stents. But rapamycin is a fascinating drug. It really is. It's very interesting how it works. So do a deep dive on rapamycin. That's a great. I need to probably do another podcast on that.
It's super interesting. Thank you for that comment, Wilma. And I see Dr. Creech is in here over on Instagram, and I think we're gonna do a podcast with Dr. Creech here soon. I'm pumped about.
Yeah, we are.
Um,
She's
so
got some great ideas about
I love it.
what we can talk about. She really thinks outside the box, and
I love it. I love it.
great,
Dental
great
health is
dentist,
so
great
important.
dentist. Everybody I've sent to her has just been so thrilled with their care. So
I love it. Dr. Creech, thank you so much for being in here. I'm looking forward to our next recording. Okay, let's get to Kathy here, and then we're going to move back to, I see there's an Instagram question. What is lipedema, and can it be reversed? And I hope I pronounced that right. What's your thoughts on this?
lipedema? Yeah,
Lipedema.
those are. Some people confuse it with lymphedema, but it's a different thing. It's just fatty deposits. I don't know that it can be reversed. I've had somebody ask me that same question about a year ago. And, like maybe the most common example of it would be cellulite appearing. It's not the same thing as cellulite, but it appears like cellulite. It can get on the lower extremities. It can even get on the upper extremities. But there's various treatments people try to use for it, like lasers and all that kind of thing. But it's one of those things that usually it's mild. I've seen some pictures of some pretty bad cases of it. But I can't tell you that I ever treated a severe case of it. My daughter Kelly could probably tell you way more about that than I can, because
Mm.
one of her friends has it. I'm pretty sure Kelly's tried some laser treatments on her for this. Um, but yeah, abnormal deposits of fat.
Mm. Kathy, thank you for that topic there, queuing us up there. That's a really interesting
And it's
topic.
different from
Yeah,
lipomas,
yeah.
but yeah.
All right, let's keep moving here. Thank you, Kathy. I see Patricia is in here for the second week in a row. Thank you, Patricia, for being with us again. We certainly appreciate that.
Is Patricia from New York City?
I do not believe so. I know NY Debs is from New York,
That's what I'm thinking about.
upstate New York, and NY Debs loves the methylene blue. I do too. I do too. Let's get to Luann over on Facebook. What do you do? What do you do for thyroid issues? T3 is 2.2 and reverse T3 is greater than 12. Being told I could have a T3 conversion issue. Anything kind of stand out to you with this from Luann?
Yeah. We do a lot of thyroid management, of course, and that's a low T3. All the money's in the T3. It's not really your TSH or T4. It's the free T3. I hope you're talking about free T3. But that's on the low side for sure. Reverse T3 can bind up the sites for T3. T3 is the active form of thyroid. That's what gives you. That's what makes it work. So if for some reason you're converting T4 to reverse T3, then you need more T3. So sometimes I'll use Cytomel and follow those levels. Again, thyroid can be a complex issue, but we'll check all kinds of labs for that. Not only just TSH, free T3, free T4, reverse T3, but also TPO antibodies. Jamie can tell you a lot about this if she's still on here, but yeah, I mean, it's really a thorny issue a lot of times, and so I usually have to give more T3. And the thing with T3, it's shorter acting, so you have to dose it more than once a day. But it also you have to look at your insulin levels, your cortisol levels. There's a lot of different interplaying hormones that you have to look at with this. So it requires a little bit of a workup, but you definitely have a T3 conversion issue, because reverse T3 is not active. Doesn't help you any.
And I see Margot also commented on this as well. Margot's amazing with thyroid, so thank you, Margot.
She's our thyroid expert.
Yeah, thank you, Margot, for commenting there and helping out. That's awesome. And thank you for that question. Such a great question, very common, Luann. Thank you so much. Let's go over to Instagram. Thank you, Ray. If you're still with us, thank you so much, man. Let's go to Kozart is asking, is it important to adjust your back and where should I go? So I think this is a kind of a chiropractic type question. I know we're friends with so many chiropractors and I know
we are. Gosh, yeah. We've got some good friends that are chiropractors. I like chiropractors. I visit several chiropractors. So come to me with a particular issue, and I can help you with a referral on that probably.
Because it is very specialized.
There's so many ones I really like. Dave's my man. I like Ava.
Yeah.
Gosh, there's so many out there. I'm blanking out on.
Well, we got Apple Healthcare in Knoxville, where we're on.
Yeah, Knoxville. Now. Yeah, I mean, gosh,
incredible.
Unbelievable. They do so much. The Hosenfeld brothers are just amazing providers. 3 brothers.
Yeah. All
chiropractors, and they've built up a great practice and reputation. And they believe in a lot of the other stuff that we're very synergistic on. So health-wise.
Kozart, I hope that helps. I know that was kind of a very general answer. I think generally speaking, it's a good thing to do. I would recommend, like, you need to go to somebody good. Like with anything, there's great people doing hormones and people not so great. And like with anything. Same with chiropractic, I'm sure. I see Dr. Creech is saying we're going to be talking about alternative treatments to fluoride. That's going to be our next topic with
Oh,
her.
good. I've been wanting to get a dentist to talk about that forever.
I love that.
None of them have the guts to do it,
I
but
love that. Oh, I see Jones Chiropractic. That's right. Thank you, Carter.
David,
Jones?
Jones and Brian and all the boys down there, and just fantastic. They have a lot of complete services too. I'm in there a lot. I really like Brian and his crew over there. Just fantastic.
Tom's a fan of chiropractors. I love it. We are too. All right, let's keep going. If you guys have questions around the fluoride thing, let us know, because Dr. Creech can look at them, and we'll kind of plan out that episode.
A lot of controversy over fluoride.
Yeah.
Should it be in our water systems, or should we just use it on our teeth? Or should we use it at all?
It's interesting. Okay, I want to get to everyone tonight, so I'm going to keep moving. Let's see, Sarah. Well, this is a comment, so thank you, Sarah, from Charlotte. She started Shield Nutraceuticals Pure Chitosan. I've been taking Digest Shield for years. I'm hoping it doesn't bind to good fats, but I'm hopeful about it overall. Definitely watch the episode we did with Steve on Pure Chitosan. Steve is like the expert on chitosan, so so definitely check that out, and let us know. Let us know how it's working for you. We'd love to put it up here on the show. So thank you for putting this in there. I see you got a daughter at UT Knoxville. That's amazing. That's amazing. That's where I went. Okay, let's get to Linda. A friend has a prolapsed bladder. She refuses surgery repair. What are future health issues without surgical repair? So what could happen if they don't get surgical repair?
Well, you need to listen to an upcoming episode I have next week with a physical therapist named Paige Mayo. We do a long talk about, bladder slings and ways you can do it without surgical repair. As a matter of fact, Paige, that's all she does is pelvic floor things, and it's awesome. Listen to that podcast with her, and you probably need to go see her.
It'll be Tuesday.
And she really, she doesn't like to mention the word surgery. She does not like to even say the word surgery for that. Not that some people may not need it, but listen up on next Tuesday.
Tuesday morning, 8 a.m. Linda, that'll be out.
8 a.m. It'll be out Tuesday morning.
Tuesday morning, 8 a.m. The video will be out. Yeah.
Oh, really? You put it out at 8 a.m. I didn't know that. That's early, Ben.
I know. The team gets it out at 8, and it'll be there a week from today. So thank you for teeing us up on that.
Timely question. Yeah.
See, Patricia's in Milford, Michigan. I love it. I love Michigan. I'm a huge fan.
I love Michigan in the summer.
In the summer. Yep. It's like it's the best summer place to go. And
Ben and I spent a lot of time at Kalamazoo, Michigan.
Yeah.
With tennis, the biggest tennis tournament in the country is there for juniors every year. And I remember going up with him many times and eating those blueberries. Remember those good?
Oh yeah.
That's and cherries.
There we go. There's a little sneak peek.
All right. That's a sneak peek.
I love it. Thank you. That's coming out Tuesday, a week.
What a timely question.
Yeah, that's cool. All right, we're going to keep going here. Did we answered that one? Okay. All right, I'm going to get to Ray's question on YouTube. Can methylene blue be beneficial for treating or preventing prostatitis? If so, what dosage?
I'll be honest with you, Ray. I've never used it for that. And prostatitis is it's hard to treat. I've had it. As most 70-year-olds probably had an episode or two. But the thing about prostatitis, it's not going to hurt you. So you can certainly try it. I like it for UTIs. The problem with prostate, that prostate tissue is deep. It's hard to penetrate it. It's easy to coat your bladder with methylene blue or, infiltrate your urine, but the prostate gland is tricky. It really, and the thing about it too, we always hit it with antibiotics for a month, maybe 2 months, which is tough because of that gut microbiome disruption you're going to get. But I would say more along the method that it may help prevent it rather than treat it. Even though a lot of times we hit it with antibiotics, the cause is usually not bacterial if you do the research on it. For some reason, it gets inflamed. But it can be a devil to treat. It really can. It can take a while to get it calmed down. But, we use a lot of anti-inflammatories. And unfortunately, a lot of times we have to resort to longer doses of Doxy. I hate to put people on Cipro for that, but preventing, maybe. There's probably more evidence out there, or that it can maybe prevent it, because along with the other anti-inflammatories, I think it potentially could help. You want to keep that prostate gland not inflamed. But great question.
Ray, thank you for that. I hope that helps a little bit. I'm going to keep moving here, get to Michelle. I've had cancer and I'm on the hormone pellets. Do I need to take an aspirin every day? My gynecologist says I'm in danger of blood clots. Really great question. Michelle, what's your thoughts on this?
Yeah, hopefully your cancer's been cured. I don't know what type of cancer it is, but yeah, you're not in danger of blood clots from the pellets, but you're in danger of blood clots because you've had previous cancer. And if you're over 50 years old, you're in danger anyway for it, from COVID or whatever. So I really am big on an 81 milligram aspirin for almost all my patients. At men, I start at 40, which I started at with an 81 milligram. Women, 50. Sooner if you have risk factors for heart disease. Okay, so in the cervical. So you got everything out. Apparently you're doing great. So certainly, there's a lot of misconceptions about hormones causing blood clots. Certainly that's why you never use an oral estrogen or testosterone. That's why you're doing the pellets or cream, because they bypass the liver. They're not going to affect your clotting factors. But for overall, I would definitely say they're right. You should take an aspirin for other reasons to prevent blood clots. The only reason not to is if you had a peptic ulcer, a blood dyscrasia, a weird bleeding disorder, or you're very old and you're falling all the time. You're at risk of hitting your head and bleeding in your brain. But otherwise, definitely I'm for that use of that aspirin for sure. I hope that answered.
All right, Michelle, I hope that helps a little bit. Let's get to Patricia with the thyroid question. I take iodine daily for my thyroid on the form of Lugol's drops.
Yeah,
what is your recommended dosage, or do you even recommend it?
Sometimes I'll put people on Lugol's. I think the normal dose is about 12.5 milligrams, but really I don't put anybody on a high dose of iodine. Lugol's is the most famous one, unless I really do a test first just to make sure. Now, most people are probably iodine deficient, but for those that are not, maybe the 20% that are not, you can really rev up your thyroid too much. You can be in danger of thyroid cancer. So, and the way I test it, and again, it'd be better to test it, of course, when you're not on it, because when you're on it, it's not going to mean a thing. But I like the ZRT dried urine spot test, because the blood test is just not going to be accurate for it. But so if you're off of that for a month, and do your ZRT dried urine spot iodine test to see what your level is. It's a metabolite test. But certainly I have a lot of people that take Lugol's that really like it. They really feel better on it. So if you're on that, you get a baseline thyroid scan too, and make sure you follow your thyroid function test.
Patricia, I hope that helps a little bit. Thank you for putting that in there. Great thyroid question.
Great question.
Let's get to Jonna here. Do you find mold/mycotoxin illness to be a reason for immune suppression very often? Awaiting mold test results, CD57 is 8 and having trouble getting up. What's your thoughts on this?
Yeah, certainly mycotoxin illnesses around. Yeah, and it's definitely an immune suppressing thing. There's a lot of overlap with MCAS, which I did a podcast on, mast cell activation syndrome and mold. There's a lot of people that think mold and Lyme overlap a lot, along with MCAS. But certainly you need to do a detox, and you need to get the molds out of your house or wherever it is. 20% of the population is susceptible to mold illness. The other 80% just doesn't get it for some reason. Who knows why? I don't know. I can't tell you how to get those CD57, levels up, other than detox, avoidance, and follow some of the MCAS recommendations, like H1 and H2 blocker, Singulair. Keeping inflammation out of your body, healing your gut. The stuff all kind of works together.
Yeah.
And there is something called VIP nasal spray. Vasointestinal peptide, I think is what it stands for. If you can still get it, they've cut a lot of peptide uses out for some reason. But look that VIP nasal spray up. A lot of times people say that really helps your immunity from mycotoxin illness. Yeah, great question. That's a tough one.
Yeah. Thank you, John, for that question. It's such a great question around mold and stuff that I know people are concerned about. I'm going to put this comment up for Max. Prostatitis, my urologist gave me doxycycline, helped very little, and then he changed to tadalafil 5 milligrams, said it will work. If not, we'll do Telescope. Super, super interesting. Thank you, Max.
Certainly we use a lot of tadalafil for not just ED, but we use it to relax the smooth muscles of the prostate. I think tadalafil is a great medicine. I take a small dose daily. Helps enlarge prostates. It definitely is a nitric oxide agonist, so it relaxes all your blood vessels. So it helps your circulation. So it may. The other thing that was effective for me was a little bit of finasteride, which is a DHT blocker. So it really helped me when I had it. But then you want to, get off of it after that because it can have some side effects. But yeah, great comment. Tadalafil is an all-purpose drug. And Doxy, like I say, a lot of times it's really not bacterial in etiology. It's more inflammatory. So that's probably a mainstay.
Thank you, Max, for that comment. Let's get to this for Trevor. Are either of you familiar with the polyvagal theory? Doc, what's your thoughts on this? Are you familiar?
I don't know if you're trying to stimulate the vagal nerve with that or what. So certainly we do a lot with the vagal nerve, but polyvagal therapy, I'm not real familiar with it. So we'll have to, if you give us some information on looking that up, then we'll certainly use it. A lot of people stimulate it via not only deep breathing exercises, but electrical stimulation. But yeah, so I'm not going to say too much about it because I'm not that familiar with polyvagal therapy.
Trevor, I'm going to write this down, and I'll make note of this once we call it a show, and we'll do a little more digging into that. I want to get to just one or two more questions real quick, and then we're going to call it a night. From Linda, your opinion on using frankincense essential oil. Are you a fan or not a fan?
I'm a fan. Yeah, I love it. That's one of the big ones. I love frankincense.
All right. Thank you, Linda. Let's get to Wilma. So we talked a little bit about your Bactroban strategy last week. Bactroban can be ordered in gel. Is that as good as the prescription? And I think I'm interpreting that right, Wilma. If not, let me know.
Bactroban, it says Bactroban, but you mean Bactroban,
I'm assuming
muflupiracin, which is an antibiotic ointment.
Okay, so what you're talking about? I think, and Wilma, correct me if I'm wrong.
I think it comes in a cream and an ointment. but it is a prescription. It's a prescription ointment for infections. If that's what if you're talking about Bactroban, Bactroban. But I don't know. It sounds like you may have written that in and it just misspelled it, like I do so many times on my texting with people.
I think we're going to have to call it a show here. I want to put this up from Mark because it is a great comment. New COVID variant KP.3, 1.1, maybe different replication patterns in the gastrointestinal tract, potentially resulting in increased viral loads and leading to more pronounced gastrointestinal issue. Methylene blue has demonstrated disrupting the COV2 spike protein ACE2 receptor. Would enema be efficacious? Man, I hope.
Yeah, but it wouldn't be a lot of fun.
Okay. Okay.
Yeah, I don't know. I think I'd rather take it orally because you can get it in your whole GI system. But certainly, you're right. The second time I had COVID, it really tore my gut up. It caused a mild cold, but because of some other stuff, I was on a steroid for a meniscal tear, and also I was on I took an antibiotic, and it really just disrupted my whole gut microbiome. So yeah, you got to be careful about that. And I have seen some of that, but I'd probably rather take the oral methylene blue.
All right. Thank you, Mark, for that comment. Guys, I think that's going to do it for this evening. How did we do? 1 to 10, we do okay. Doc, I thought you were a 10 tonight, especially with the way you were looking in that hat. I thought you were an absolute 10. Tom, I see you. I will. I'll check my email right after this. Thank you for that, Tom. Carter, yes. That's a good move, Carter. That's a good move. I love that. I'm gonna put that up. Little combo there.
Great little combo.
Steve, thank you so much, man. Hope you're feeling better. Yeah, keep us posted. Keep us posted. Thank you, Patricia. Thank you, Carter. Thank you, Mark. When Mark gives us a 10, that's when you know. That's when you know.
Mark's a hard grader, so if he gives us a 10, you know you deserved it.
Ivy,
more on
thank
your part
you.
than mine, but
Michelle, thank you. You guys are the best. Doc, you're the best. Thank you so much, man. This was a blast.
Thanks, Ben. Fun.
Let's see here. Okay, we're gonna call it a show. I think if I missed a question, we'll look over this at the end, but I do believe I got to everyone. But if not, shoot me an email, ben@performancemedicine.net. I'll put you up first on next week's show. Thank you, Michelle. Thank you, Cherry. Thank you, Michelle. Dad, I love you, man.
Love you, Ben. Good night.
Good night, guys. We're heading out. Where's my outro, Brad? Come on, Brad.
Don't go away.
Hey, my man.
All right, how we do?
That's good.
You did really good. You did really good. Sorry I wasn't there at the beginning to help you out with a couple of those PRP things.
Oh no, I thought that was awesome.
I have the PRP thing down here, just in case. Like it's at the way bottom.